With us, we have our CEO, Scott Livingstone, and we have a number of people on the line as well. But to kick things off and do introductions, I'll give it over to Scott.
Thanks, Jenna. Thank everyone for joining us today. I'm joined today by teleconference by Dr. Shahab, the Provincial Chief Medical Health Officer, Dr. Julie Krasnowski, our Senior Medical Health Officer, and Mr. Derek Miller, our Emergency Operations Center Commander with the Saskatchewan Health Authority. I'd like to take this opportunity to publicly thank all three of them for their hard work and sacrifice preparing the province for COVID-19. As you know, we represent a SHA team of over 44,000 healthcare workers, and we're very proud of the work that they've done. We are served in this province by a very dedicated team of healthcare workers that are making significant sacrifices to serve the people of the province. Last week, the Saskatchewan Health Authority released our COVID-19 Readiness Plan, which focuses on both our offensive and defensive strategies for responding to the pandemic. Today, I'm going to share some of the critical updates on our offensive strategy, and as part of that, I want to start by thanking the people of this province, every single resident, for making sacrifices to make our strategy successful. You are making a significant difference, and we hope you will continue to do so. We know it hasn't been easy. People are hurting personally and professionally. The emotional, mental, physical, and economic realities of this becomes increasingly difficult with each passing week. But you know, and we know, that you're making a difference. You're giving us time and ability to prepare our healthcare system for what may come. The Saskatchewan Health Authority is continuing to mobilize and prepare based on the scenarios shared last week. That has not changed. And while we will continue to update the modeling numbers in the upcoming weeks, we continue our current path of planning for the worst and aiming for the best. The reality is we don't know what will happen, and we cannot move a single healthcare system our size overnight if suddenly something shifts for the worst. Each of you are depending on us to be there if and when you need us, regardless of the scenario that plays out over the next coming weeks to months in this province. That's why we're enhancing our offensive strategy with an increased focus on testing and contact tracing. We've expanded COVID testing outside of Saskatoon and Regina to improve the turnaround time of tests in the province. And this also allows us for doing contact tracing and having that happen sooner, positioning us better to prevent further spread and identify and protect healthcare workers. Meadow Lake is one of the first communities outside of Saskatoon and Regina to go live with this testing. And over the next days and weeks, we will continue to expand in northern and rural communities. And also of today, part of our offensive strategy, which you've already heard about, is the Saskatchewan Health Authority is adding additional levels of precaution to protect each other and those we care for. We are working towards a provincial standard of daily screening with temperature checks for all healthcare workforce in all of our facilities. Also, as part of this, all physicians, staff who work directly with patients, clients, and residents, and those who will need to travel through a care area will be required to wear a procedure mask at all times when they are in an SHA facility. These precautions are being implemented to ensure that no one is presenting with a flu-like illness and in an effort to decrease the chance of spread of COVID-19. These measures will help protect patients, residents, staff, and physicians from the risk of exposure. These measures are about keeping our healthcare teams safe and providing an additional layer of assurance to our patients, clients, and residents who may be worrying about asymptomatic workers who do not currently have symptoms but may have been exposed to the virus. It remains a daunting and uncertain time for all of us, and our healthcare teams are no exception. I want to make sure I thank all of our healthcare teams across this province. Because of their hard work and dedication, Saskatchewan is in a strong position to respond to the challenges of COVID-19. There are no words to express my gratitude for what our healthcare workers are doing each and every day, but I also want to close by reminding members of the public that the key variable for saving lives and protecting healthcare workers is public compliance with isolation measures, physical distancing, effective hand washing, and staying home whenever and wherever possible. Please do your part to do whatever you can to help us help you. Together with the team on the line, I'm happy to answer any questions.
Maybe we'll start with a question on the line. Is there a question on the phone line?
We have Anna McMillan with Global.
Go ahead, please.
Hey, folks, can you hear me?
Yes, we can.
Sorry, I think I was muted for a second there. We're just wondering what the SHA's response is to a Nipawin church saying that they believe their charter rights were violated because they couldn't get together for an Easter service. I believe they called it a drive-in Easter service.
Okay. So as you know, the Chief Medical Health Officer has issued a public health order that limits internal and external gatherings to 10 people. Through the provincial response line for concerns about people not abiding through public health orders, our public health inspectors in the north were notified of some advertising of this event. They followed up directly with the organizers, including the town of Nipawin, and had a discussion about what plans were in place for the event, even though it was at a drive-in theater, to protect the participants from gathering outside of their vehicles, and there were none. So at the advice of our public health inspector, the organizers canceled the event, and that's what we know to date. We will be following up with the Chief Medical Health Officer, Dr. Shahab, around how we deal with these sorts of things in the future. But I do want to point out the public health inspectors did respond to concerns that were raised by the public. This is what they do. They're not in the business of licensing events of this nature. So when they're asked for their advice and they provide that advice, it's not in the context of approving these events. It's to provide the advice of how to best run these events and protect the public from doing these types of things.
Question in the room?
So it's been a week since you first released the kind of responsiveness plan and some of the modeling information. I was wondering if over the ensuing time there's yet been any sign of whether we're tracking closer to one of those scenarios, and whether the persistently encouraging data that we've been seeing over the last week might lead you to update some of those scenarios and to change some of your responsiveness plans in light of the low numbers.
Okay. So it's a good question. As you know, when we presented the plan has always been presented both from an offensive and defensive perspective as a stage response based on what we were seeing. As we've committed to regular updates, we will include our modeling updates. We don't have any updates, as I've already said, to the modeling today, so we are still preparing based on the models that we used last week. There are encouraging signs of how the public distancing and the good work that our communities are doing to prevent the spread of COVID, but we don't have a crystal ball, as we said before, so we don't know what's going to happen next week, and I think things are encouraging, and as we move forward over the next week or two, we will have updated models and we will be sharing those. And the plan would be adjusted.
And can you also provide a little bit more detail on how the defensive strategy is going? I mean, have you yet been able to add a significant number of intensive care beds? Can we just have some updates about
Sure.
how?
So just before we get to that, I'm getting a message that folks on the line are having a hard time hearing the question, so I'll just repeat the question so that everyone can have that. The question was related to the defensive strategy. How is that coming along, and have there been actions taken to address that?
So as you know, the defensive strategy has been in place for weeks, and it started with the reduction of elective procedures across the province, which has already built a significant amount of capacity in the facilities. Because we're not exhibiting a high number of inpatient cases or a high number of outpatient cases, we still have that capacity. So today, as an example, we have 50% of the provincial available beds without us actually putting more in place or available today to care for patients as they require ICU care. And we have over 1,000 acute care hospital beds available today to care for patients as they come in. The plan is still in place to significantly increase those services over the next few weeks and months as it's required, but we haven't actually done much more than that, than sharing the plans with the communities and working through the EOC on how we're implementing plans to address the concerns that we believe may occur.
Let's go for another question on the line, please.
We have Guy Quinville with CBC.
Thank you. The Premier mentioned yesterday that you're finalizing protocols to limit staff moving between long-term care centers. But what are the specifics of those protocols? Like, for example, will you stop staff from working at more than one place altogether? Will those workers be able to work at other side jobs, like, for example, only working at a grocery store? And why haven't these protocols been implemented already, given that around half of COVID deaths around the country are connected with long-term or retirement homes?
So there are a few questions wrapped up in that question. So let me start by saying, yes, as the Premier has mentioned, we are working with our partners, affiliates, unions around addressing the concerns about staff working in more than one facility, particularly in long-term care, but this is not unique to long-term care. That work is ongoing, and we hope to have strategies in place that will likely include a cohorting of staff. So today we have a number of staff that work in more than one facility. It approaches almost 20% in long-term care as an example. So to be able to ensure that we're not just protecting the people inside the facilities and those people that work inside the facilities, we need to ensure that we have the staff available to properly care for those folks. So this work is ongoing, and over the next few days and likely weeks, given the number, not weeks, but probably in the next week or so, we'll have a more definitive plan on how we're doing that. Will we limit folks to one single facility? If we have the ability to do that based on the workforce that's available. And the other highlight I'll have is, as you know, through our experiences in other jurisdictions, a very high percentage of healthcare workers are infected with the virus or have a tendency to be. So we have to keep those numbers in mind as well as we're planning around cohorting patients. But we will be putting plans in place to do so. Why hasn't it happened sooner? It's not as simple as saying you're going to work in this facility and you're going to work in that facility. People have guaranteed hours. They have work skill sets that might not be movable to other facilities. And we need to follow the right process to be able to do that. I'd also point out, though, that we've had a number of other measures in place for our long-term care facilities, including the testing and outbreak management in long-term care, as well as the testing of healthcare workers coming in and out of those facilities, which today we're going to expand that across all of our facilities, as I've mentioned, but we've been doing that in long-term care for a while now, including our affiliates.
There's a question in the room.
The advice that the public health official gave to the Nipawin Apostolic Church was that they strongly recommended against a drive-in church service where people would be sitting inside their vehicles. Was that the correct advice to give them?
So the question is related to the drive-in service at the Nipawin Church, and the advice that was provided was there was a recommendation not to hold the service. Was that the right advice?
As I said, we'll be following up with the Chief Medical Health Officer around how to deal with situations like that, but in response to your question, specifically with respect to the public health inspector's guidance, in the absence of having a plan for keeping people in the vehicles, the public health inspector felt that if they're not going to be able to do that, that it does put people at risk. And that's why the advice was provided.
Can we take another question on the line, please?
We have Zach Vicera with the Star Phoenix.
Hi there, can you folks hear me?
Yes, we can.
Wonderful. On the long-term care file, you've obviously now we have advanced screening measures in place for many healthcare workers in these facilities. I'm wondering if there's been any conversation about expanding those procedures to places like for example, care homes for people with intellectual disabilities, or even homeless shelters, other vulnerable populations that could see a sudden outbreak of COVID-19.
Yes. So the work that we're doing around healthcare worker, or in our cases, healthcare workers that are working in our facility, would apply both to affiliates, personal care homes, and community-based organizations that we will be working with.
Is there another question on the line?
We have Matt Young with CTV.
Hello, Matt Young from CTV here. Can you folks hear me?
Yes, we can.
Okay. I have a question about the testing equipment that's arriving in Meadow Lake and Prince Albert. Could somebody please elaborate on, is this just a piece of equipment that a physician or somebody from the health authority or health workers could just plug and play right away? Is there training on this? How long is it going to take until they can fully use this testing equipment? And could someone elaborate a little bit on the procedures and methods that are used to get this testing equipment up and going? Is it a matter of just testing people right away? Could somebody just provide some commentary on that?
So Derek, do you want to take that question?
So I guess I'll say that the testing equipment that is being rolled out to these alternate sites are meant to provide additional capacity in the system, and also to allow for a quicker turnaround. And I'll actually ask Dr. Krasnowski to maybe comment on the technical aspects of the equipment.
Sure, I'm happy to provide some additional details, and we can follow up as well if this isn't enough. But like Derek said, the purpose is to decrease the turnaround time so that these machines are being deployed to rural and more remote sites in the province, so that precludes the need to transport specimens to labs in either Saskatoon or Regina for the testing. They do test in small batches, so it's just a few samples at a time that are tested, and they are being used to test priority populations so that the results can be available more rapidly, and that will help manage both the care of patients, but also any public health measures that need to be put into place. So they are called Gene Expert machines, and they use a cartridge-based test. So it's a positive or negative result based on the sample that's run through the Gene Expert machine.
There's a question in the room.
Do we yet have any kind of estimate about what these, preparation efforts, both the ones that have already been done so far and those that are part of the response of this plan, are going to cost?
The question is related to costs around the preparation efforts. Are there any estimates at this time on costs?
Not specific to the overall effort. I mean, certainly on the ordering of PPE, which is, we would be ordering 3 to 4 times what we normally would. And unfortunately, we're not paying the same prices we would normally, given the global issues around access to PPE. Certainly, we haven't got a running total yet, but we are tracking the spend on COVID-19 and will continue to do so. And a lot of that is going to be completely dependent upon how much of that phased-in plan is going to be put in place and how quickly it needs to be put in place to respond to what's happening with respect to patients in the province. As an example, the full operation of a field hospital would not be an insignificant cost because of the equipment and the other services that would have to be put into that facility to function, in the event that we're caring for patients inside those field hospitals. So that would add significant to the cost as we move forward if that would be required. So I don't have a number for you today. We can follow up a little bit, but we are tracking the costs associated with the COVID-19 work across the SHA.
Can we take another question on the line, please?
We have Lisa Schick with CJME.
Hi. I am just wondering, I looked at the document that came with the release, and it said that the SHA, I believe, has about a month's worth of PPE. So I'm just wondering, where are we on orders for PPE? Is a month's supply going to be enough for right now? And the continuous masking that you're talking about, is that going to deplete the supply of PPE quicker or faster than you would like?
So we've been doing lots in the PPE front with respect to monitoring our daily usage and trying to track that across the province with respect to what's our burn rate. We feel that we have, as you've already said in the press release, at least a month available of all PPE for the province based on our current burn rate. With the announcements today to go to continuous masking, there is sort of an offset with respect to the number of masks that we'll use, because today people may don a mask and then move out of an area and discard it because they might not think that they're coming back into that area. But with a continuing masking policy, we feel that we do have enough masks to provide that, not just for ourselves, but for our affiliates and other partners, and we will be doing that. Ongoing orders are, every day it changes with respect to what's coming in and what's not coming in. We've started to see a trickle of PPE come in from the federal government as per the allocations that they're working on. But as I've said before, we've ordered 4 to 5 to 6 times the quantities we would normally order over and above what our normal our standing orders are. So our standing orders are still in place through our normal operations where we're doing full surgeries and that, and every other order is over and on top of that.
We'll take another question up on the line, please.
We have Adam Hunter with CBC.
This is Adam Hunter. My question is for Dr. Shahab. What's your criteria for loosening restrictions or measures as far as reopening the economy one step at a time? What are some of the things that you'd like to see as benchmarks hit before you start considering that or recommending that to the province?
So hi, can you hear me?
Yes, we can.
Okay, so thanks. So I think at this point, certainly on the one hand, like Mr. Scott Livingstone mentioned, we are extremely happy with the way our curve is going. So as, for example, today there's one new confirmed case and 187 people have recovered. So I think at this point, things are looking very positive. Having said that, obviously, we all understand and know that there are certain high risks in the province that we need to manage. One, of course, is long-term care facilities. We need to make sure that we are able to prevent as much as possible outbreaks in those settings. Secondly, we understand that as testing expands and contact tracing expands, we need to continue to make sure that all populations are able to seek testing and get the advice regarding self-isolation, contact tracing, and other things that are so essential to prevent further clusters or outbreaks. We understand that not everyone may have the same ability to self-isolate in the home setting. And so I think we need to keep monitoring those two things. But obviously, if the curve continues to be flat, we will have to look at what options we have in terms of relaxing some restrictions. I just want to underscore that, each province is following a slightly different trajectory. We started our outbreak, 4 to 5 weeks behind, other provinces like Quebec, Ontario, and BC. Will we follow the same trajectory or a very different trajectory? I think ultimately it's still up to all of us to stay the course for the next little while. And then as we continue to see our numbers, what measures can we cautiously relax, creating minimum risk to further spike, but at the same time allowing some aspects of work or other aspects of life to, continue in a way that's different from before and still manage to reduce further transmission risk. Thank you.
There's a question in the room.
What kind of plan would a public health officer need to see in order to keep people inside of their vehicles? And do you recognize that the current public health rules or advice is not being given consistently, considering that the church service was strongly recommended to not go ahead, but yesterday there were about 500 vehicles where people sat inside of them to pay respects for a family coming back to North Battleford, and that kind of went off without a hitch.
So the question has to do with what sort of plan would need to be in place to reassure public health authorities that an event could continue? And are we aware that public health orders are not being applied consistently across the province?
So I think specifically the question was around what would the public health inspector need to be assured of what the plan was to keep people in the vehicles. And I won't speak on behalf of public health inspector, but I think what he would be looking for is a plan, and there wasn't one. So with respect to follow-up, I can certainly follow up with respect to the decision that was made by the public health inspector, but I will reiterate, his actions were carried out with respect to the complaints that were received from the community. He did contact the organizers, and he did not cancel the event. The organizers canceled the event. With respect to your other question around the event in North Battleford, spontaneous event that we're not aware of is quite different than an event that was planned, advertised, and that we received public concerns about.
Are people in Saskatchewan, though, to be clear, because this is going to cause some confusion in people's mind, are people in Saskatchewan allowed to sit in their cars next to other vehicles and speak to each other and spend time kind of just in community that way?
So what I did say is we would be following up with Dr. Shahab and clarifying some of those, but Dr. Shahab is on the line. So do you have anything to add, Dr. Shahab?
So I think, could someone repeat the question, please?
So the question has to do with people being in their cars. Is there anything preventing people from being in their cars, speaking with one another while in the same space?
So I think I'll maybe speak in some general terms about what has been the recommendation to date, what may be possibilities for the future, and what have been some of the concerns from not just Saskatchewan but other jurisdictions. So obviously, if you're in your own vehicle, you and your household members, that's fine. Several people from several households getting together in a car is the same as mixing in a high-risk environment. So that certainly would not be appropriate at this point. Secondly, obviously, people will go to a drive-through restaurant, and so it's one car after another, and appropriate hygiene should be applied at the counter and with the machine to minimize risk of transmission. But if people were gathering together and there were no clear protocols, that what if someone had to use a washroom, or would there be carpooling or other opportunities where people may get out and touch a certain surface that's not being sanitized, those things would continue to increase risk. And I would just like to say that while the public health order is no gatherings of more than 10, the recommendation really is that you minimize any gatherings outside of the households. And I think we really need to understand that, so far by staying the course is exactly why we are at where we are, one new case today. And we have to be very careful going forward about staying the course, and any relaxations we do are monitored closely, because otherwise within 2 to 3 weeks we can be very quickly in a situation where some other countries in Europe and some other states in the US have been. All it takes is 2 or 3 weeks of uncontrolled spread, and you're not just back to square one, you're in a far worse space. So I think we need to still be very cautious about how we move forward, understanding that, of course, if our rates remain low, there will be some opportunities to change how we, allow some other areas of work and some other areas of beyond, taking solitary walks, of enjoying the outdoors, but at the same time, keeping a very close eye on minimizing risks.
I think we have time for one last question on the line, please.
We have Roberta Bell with Global.
Go ahead, please.
Hi, sorry. My question is regarding the Intertribal Health Authority in the North and the surge orders that they've made, saying that they didn't have enough PPE. I was wondering if the SHA or any sort of provincial partners are trying to work with the Northern Health Authority on these issues for First Nations.
So I'll start that answer. So I can tell you that for both the EOC with the Saskatchewan Health Authority, we do have a committee in place that directly links the FSIN and the Athabasca Health Authority to work that we're doing with respect to NITHA. I know that through the Ministry of Health and the distribution of PPE, there have been distributions through the North, both through our organization and through the Ministry of Health, and we continue to work with that the NITHA group on distribution. I don't know, Derek, do you have anything to add?
This is a priority for us, and we recognize that those communities and especially as they're delivering health services, we need to ensure that we're supporting them, and we're actively working with our partners in those areas to ensure that we do.
There's one last question in the room.
I just wanted to ask, at what point, if we continue to see these kinds of consistently low case rates, do we, as the SHA, kind of consider going back to business as usual in terms of some of the elective procedures that have been postponed, in terms of the other measures that you've taken to increase capacity?
So the question is, at what pace of the amount of cases that we've been seeing on a daily basis do we start to move back to business as usual from a health system perspective?
And I would say that our response to actually sort of restarting the system and caring for those patients that we've sort of put on hold right now as we work through the response to COVID would have to be a staged response that the data would actually tell us whether or not we can do that. The risk that we would hold by doing that too soon, of course, would be not having capacity if something bad happened, or exposing patients intentionally to virus that we didn't have to. But what I'd say is that in the weeks to come, as we receive more data, particularly around what's happening with the spread of the disease, like the ratio of how many people are infected by a single individual, the R naught per se, or of a rate of spread, will help inform that decision. But certainly we're thinking about how we start bringing the system back up, but we're not we're not done with COVID yet, and we probably will still be experiencing COVID as we start gearing up the system slowly.
That's all the time we have for questions. Thank you.
One more clarification. What is the modeling to date has said that the current measures need to stay in place in order to be effective. They have to be sustained. What is the minimum amount of time the current restrictions for COVID-19 need to stay in place in order to be effective?
The question is, what is the minimum amount of time that restrictions would need to be in place before they're lifted?
Again, I don't think there is an answer to that question, but I would default to Dr. Shahab or Dr. Krasnowski.
Hi. So was the question about minimum time?
Yes, what's the minimum time frame in which we'd have to see low case numbers before we would start to come back to business as usual?
So I think there's kind of several parts to this answer. One is, of course, can we extinguish the outbreak totally? And in Saskatchewan at this point, our curve suggests that yes, for the time being, we are able to actually extinguish the outbreak. Where does that get us to? Well, we still have to protect Saskatchewan against importation of cases, whether from other countries or other provinces with higher rates. So that will continue to be something that we need to continuously watch for. We need to, like Mr. Scott Livingstone said, then cautiously evaluate what areas of work that have been, slowed can cautiously start with strong testing and contact tracing protocols in place to monitor for any increases either in the work setting, in the healthcare environment, or other settings. Of course, the hope is that over the next few months, as this continues, there'll be other therapeutics and vaccines that will provide another layer of protection against COVID-19 because this issue will not go away in the next little while. But then, as we get a better understanding of what the risk is in Saskatchewan and in Canada generally, and how the risk from importation is managed, then that would be one potential trajectory that we can manage the risk and proceed with de-escalation of measures. However, we have to realize that things can quickly then surge back, as many countries in Southeast Asia seeing that they were very successful in initially suppressing, but they have to continuously monitor whether it's importation of cases or other clusters that can emerge that still needs to be managed. So at this point, I think we have to look at it on a week-by-week basis and also learn from other jurisdictions who are ahead of us in the curve and also monitor ongoing importation as well as higher risk transmission settings, which in the past were mass gatherings, but now can continue to be institutional settings like long-term care or other institutional settings or clusters or populations where, although in Saskatchewan we have really good access to testing, but that's something we need to continually evaluate, that making sure that all populations have rapid access to testing as well as contact tracing. And this is an area, again, I'd like to recognize that the SHA has excelled in terms of its capacity for both testing and contact tracing, but that is something that has to be maintained for the medium to long term for us to allow other work to proceed in a safe manner. Thank you.
Thanks very much.